Hi, everybody. Uh, it's my honor to have herbalist Sam Coffman, a very special herbalist who's been with the Special Forces and the Green Berets, and he's a medicine maker, and he has a fantastic school. If you came onto this course, you probably saw a little bit about his biography, which is pretty impressive to me. And he's been impressive to all my other herbal colleagues, and we're just getting to know each other. But his reputation precedes him, and I'm really going to enjoy talking to him because he's got a different perspective on herbal medicine from my path, and I like that. Hi, Sam.
Hi, Michael. Thank you for having me here. Pleased to be here.
So I'm in Santa Cruz. Where are you?
I'm in Taos, New Mexico.
Taos, New Mexico. One of my favorite places. I understand you're moving there.
Yeah, we just moved here. Literally have just been here about 6 weeks on this new property that's becoming the new campus and a new clinic for the school as well.
Yeah. Is Ananda community still there?
Which school? Which community?
It's a yoga community. I think it was called Ananda, but I'm not sure.
I'm not familiar with it.
Okay, well, maybe you might check into that, because there will be a lot of people up there who would be very interested to know about you. I may have the name mixed up, but there's a major yoga retreat center up there. So anyway, I'm not sure exactly the many wonderful places that Sam exemplifies in herbal medicine to begin, but his orientation, as I got from looking at his book called Herbal Medic, which again is at the intro of the book. Here it is here, and also looking at his website, there's a great deal of interaction with Western Orthodox medicine, and so I wonder, Sam, how you integrate traditional herbal medicine with Western Orthodox medicine, or do you actually do that?
That's a big can of worms, but yeah.
Well, take one or two aspects of it.
Yeah.
Say, for instance, bleeding disorders. I was checking in your book. That's always an interesting one, because Chinese medicine has different kinds of approaches to stopping bleeding, anywhere from using burnt hair to specific herbs like salvia miltiorrhiza and astringent herbs. But I noticed that you're using a lot more of the actual physical processes of stopping bleeding as well, which you describe in your book. And it's something I don't know, but I've had situations of people bleeding in my clinic, especially women with breakthrough bleeding and menstruation. And it's always taken a bit of time to get that under control. I wonder if you use the same herbs or similar herbs, or do you use other methods as well to get a situation like that under control?
Yeah, that's a really interesting topic. And so I guess for me, I differentiate between external versus internal bleeding, of course. And if it's external bleeding, then the whole, hemostasis portion of wound healing, I think, is usually most readily handled with something like direct pressure or bandaging, like compression bandaging if you need to, or of course in a life threat, if you have to, a tourniquet, obviously that's external bleeding. But that said, I mean, there are many stages below that. So for instance, right, we get way into wilderness medicine and austere medicine. And so one of the questions, like we do wilderness first responder certification and WFA, wilderness first aid, wilderness first responder, most of the paradigm that sits within is there's always higher care. And so really what you're teaching people to do is how to stop life threats, package your patient or the victim or victims of a trauma situation, maybe, or environmental or whatever it may be, package them in order to be able to transport them, if they can't transport themselves, to higher care without doing any further damage and hopefully stabilizing them. And that's it. Our whole austere program is, what if there is no higher care? What if you've got higher care is, a week or a month or maybe never, post-disaster, whatever, right, it may be. So then bleeding becomes, some of these aspects that we talked about, like tourniqueting, and here I'm just talking about external bleeding, but we can get to internal, of course. But, tourniqueting an arterial bleed, for instance, at that point, you're on the clock as to how long before you may lose that extremity, that limb, because of the fact that to do it right, of course, you have to cut off all arterial flow to anywhere that's distal to that injury.
Right.
And so then one of the questions that comes up is, all the time is, well, let's say we're in an austere situation and we're talking about austere medicine where there's no higher care, and we certainly don't want to do an amputation or have to deal with that if we don't have to. Can we convert that tourniquet to something else to where we can, heal it? And that's where something like a hemostatic comes into play. So for instance, if you're taking a tourniquet and you're converting it to something like a compression bandage, there's not a lot of protocol out there that's well known. It's not done that much because, the vast majority of tourniquets are going to end up in a surgical, OR somewhere so that they can be done there. But what if you had to do that? Well, the tourniquet, one of the calls for that is you have a second tourniquet that's a backup, and then you release the first tourniquet and you do it in a very slowly. And then you stop the bleeding with some sort of hemostatic, right? Now that could be something like chitosan that you can get on, anywhere that you could mix in with something like a wound stoppage powder that had other herbs in it, like for instance, yarrow, or one of my favorites is Canadian fleabane, Echinacea canadensis or Erigeron canadensis is fantastic for that internally and externally, or any of our, kind of our hemostatic herbs. Chaparral is a great one for that, and even just the powder itself. The actual physical action of the powder is going to help.
Coagulation a little bit.
Coagulation, yeah, exactly.
Right.
That's where something like that would come in handy. But otherwise, the whole idea of having like a bleeding stopping powder, is to me is like, well, just use good, first aid technique and direct pressure usually will take care of that problem until those other things arise that I was talking about. But what about internal bleeding? How do we deal with that?
Well, what do you think, before you go to internal, what do you think of cayenne pepper?
So yes. I think so. I mean, I think there's a lot of unknowns there, right?
I got that from my first training with, of course, Dr. Christopher, who you probably heard of.
Yeah, and he loves cayenne. Of course, cayenne's in every single formula,
Cayenne doctor.
Yeah, cayenne, exactly. And I love cayenne too. I think cayenne's awesome. But here's what I think. I think that with internal bleeding, again, we're not so much looking at clotting as we are trying to speed up the inflammatory process around a wound. And this is where there's some sort of paradoxical or type of information that people might say, well, something like yarrow, for instance, is actually, or salvia multiriza, like you're talking about, red sage, do they actually stop bleeding, or do they increase the inflammatory process around the cardiovascular system so that our body moves quicker? We have maybe more white blood cells, more neutrophils and macrophages, and all the process that goes on there between signaling that has to happen in order for hemostasis to occur in that blood vessel that's broken, and all the capillaries are broken, all the garbage that has to be cleaned up. There's a lot that has to happen there, and there's a lot of disturbed or torn injury if we're talking about trauma, for instance. That I think, or even if we're talking about an acute, onset of some sort of a chronic, weakness or chronic condition. So really, so I always talk about like the difference between Western concepts of anti-inflammatory, for instance, versus the herbal, and this includes, TCM and Western herbalism. Talking about anti-inflammatories, it's a totally different paradigm. It's not so much anti-inflammatories as a pro-inflammatory in a way that supports inflammation and supports hemostasis and supports all the things that have to happen to stop that bleeding and move into the second phase of healing, which is, inflammation, and through that into proliferation for new tissue. Interesting, because there's some Chinese herbs here too, like Prunella vulgaris, like, self-heal spike, and also salvia multiriza is one of them. I believe astragalus. There's some interesting studies that show that they increase the NO, the nitric oxide and enos, or endothelial nitric oxide synthase relationship, and increase that gas that's very important to be able to heal the endothelium of broken blood vessels or disturbed blood vessels. And that, that the use of that gas, the production of that gas and the usage of that gas is very important to the cycle that goes on around moving from inflammation, pro-inflammation to inflammation in proliferation. And so we find herbs that are doing exactly what I was just mentioning, that are really not anti-inflammatory or even hemostatic. They're supporting and is speeding up a process of healing, down at this very microscopic level, I think.
Well, I think when I asked that question, you gave me a lot more than I asked for. But I think you're saying something which I tend to exemplify in my teaching, that bleeding is actually seen as blood stagnation in Chinese medicine.
Right.
In other words, the blood is stuck in one place, and it happens to be coming out there. And so that besides using hemostatics, one uses blood movers to actually get to normalize circulation. And I think that's somewhere in the mix of all the scientific language and jingo that you were using that I don't quite understand.
Yeah, I agree. I think that's so wonderful about Chinese medicine.
I think that's something that you were trying to exemplify. So
I agree. Well, I think those metaphors in Chinese medicine oftentimes have a place that really makes sense when you think about them, and you can find the relationships, those analogs with Western medicine as well, which is fantastic. When you can do that.
And many of the hemostatic herbs, I can't think of any offhand, but that actually stop bleeding also move blood. And one of the great ones in that category is Panax pseudoginseng.
Yeah, right.
That's one of the most valuable herbs, I think, on the planet. And the reason I think that is, for one thing, is that it's a paradoxical herb. It does opposites. It moves blood and it stops bleeding. And it also tonifies qi and tonifies blood. So when an herb does two opposite things, I always think that that's a strong herb. And so Tenshi ginseng, I think, is my go-to herb that I always use when there's internal bleeding or serious bleeding that is functional.
Well, then there's empirical usage of that herb, even back in the Vietnam War, as Yunnan Baiyao is using it for internal wounds and internal bleeding, and being the main ingredient. Of course, I know there's a lot of the formulas of that are considered were secrets and such, but that was probably the main ingredient in any of those different formulas.
Do you use Yunnan Baiyao in your teaching?
So I do, but honestly, I don't think, again, I think, as much as I also like, Noto ginseng very much for that, but man, I really like Canadian fleabane for that. And it's one of the most potent. I've used it for like,
that's fantastic. Where do you get it?
On any roadside, pretty much anywhere in the US, which is what I love about it. It's so prolific.
I love that too, when it's really available. So I just made a note about Canadian fleabane. I've never used it, but I'm going to definitely include it in my thought process of what to do with bleeding. So you'd use that both internal and external, I guess.
Yeah, and I first started using it. I think I read one of Michael Moore's takes on it, using it for ulcerative colitis and bleeding, and bleeding in
he was incredible. I think if there was really somebody who was before me and before my generation of herbalists, at the time when I started, I thought I was the only guy in the country that was crazy about herbs. And then I met Michael Moore, and he had been doing it at least 2 or 3 years or longer than I was, and I didn't even know what herbs were when I met him. So, but I always found him very, very difficult to understand in his teaching. But his books that he's written on specific locale and herbs and that locale are classics as far as I'm concerned.
Absolutely. Yeah.
And I'm sure you've used a lot of those as well as I have. So So he uses Canadian fleabane for internal and external bleeding as well.
At least as far as I know. I mean, that's the only thing I saw was a reference for ulcerative colitis. And so I used that later and I used it in the formulation, but then I started to find it was very useful for external. And I was given a class, like a survival class one time it was actually on Navajo Nation. And there was a class of young folks, mostly like teenagers, and some of their parents were there. And there was one young man who had this chronic nose bleeding issue, just chronic. And he'd had some minor surgery for it, and it was definitely an issue. And so he started to get a nosebleed during that class, and we were doing an herb walk at the time, and we were in this little dry kind of canyon gulch, and there was Canadian fleabane all around us. And I said, here, and I didn't even have him, you can use it topically, but I said, and it's kind of got a taste like a mustard. It's not a mustard family, but it tastes, it has that sharp kind of, spicy taste. I said, chew on this just for a little bit and let's see. And he did, and his nose bleeding stopped, and right away, like within 30 seconds, his nose bleeding stopped. We talked a lot about that. Of course, we harvested a bunch for him and his family, and they continued to stay in touch and say, wow, this stuff, is amazing. I've used it rectally for people, in suppositories for people that are dealing with rectal bleeding from things like prostate surgery and cancer and rectal, any kind of surgery where they've got rectal bleeding. So topically works very well for that too. And an ulcerative colitis, of course, never had a chance to use it.
Would you say that you're using it mainly symptomatically, and does it work with all constitutions and all basically native imbalances?
Who knows, right? I mean, yeah.
From my point of view, many of the things that are supposed to work in terms of an acute situation, or even or specifically for condition, don't oftentimes work with herbs unless you're dealing with the underlying deficiencies as well.
Of course.
And in Chinese medicine, those deficiencies are different from how Western herbalists traditionally have looked at what deficiency means. They classify the 4 deficiencies as yin, yang, and blood and qi.
Yeah.
So I have one incredible case, because I kind of rediscovered Echinacea. I was the guy. I lived in a commune in Northern California, and there was like lots of staph infections that would come up there. And I used all the standard herbs, and internally and externally, plantain and yarrow and all that stuff. And in those days, we came out of the haight-ashbury thing, and in the haight-ashbury, there were 2 herbs that were mainly used. One, of course, cannabis, and the other one being golden seal. And everybody was using golden seal for everything. And of course, golden seal does work for some infectious conditions very well, but not all of them. No. So we had golden seal on the ranch, and we used it a lot for the many staph infections that would show up. And then there weren't many books to learn from, and I didn't have any teachers. And so I looked in Jethro Kloss, and under infections, and he has, like, as I recall, 36 herbs mentioned. He doesn't say which one for what condition. And I just did this crazy thing and chose the one herb that nobody ever heard of, that had the strange spelling, which Echinacea was. It was Echinacea down towards the bottom of the list. Mm-hmm. And I said, well, God, with a name like that, it must be a powerful herb. That's where I was coming from when I started herbal medicine. And I had made friends with the last herbal pharmacy in the United States, a man named Nathan Pothurst, at Nature's Herbs on Ellis Street in San Francisco. And he was a funny guy. He was like a German racist. And somehow or another, when I came in there, I wasn't dressed up in my full hippie regalia, mountain man regalia, and he couldn't believe it. Somehow or another, we became friends, and I overlooked his prejudices, even though they were not very nice to think about. And he said, "Oh, that herb." When I mentioned Echinacea, he says, "Nobody ever asked for it anymore. I'll see if I have some down in a jar in the basement." and I'll just give it to you. So he went down to the jar and he gave me some old Echinacea. It was probably the last 8 ounces that he had in the store. And I took it back up to the ranch and started experimenting with all infections, actually. And I worked out the whole protocol of how to take it. And it worked like a charm for every infection going, both internal and external. And I decided, since I only had 8 ounces, I needed to tincture it. And I also made up this idea that basically small doses frequently and you give it 3 days. And if it doesn't get any better, see the doctor. And so I worked out that protocol. Every 2 hours, take 30 drops of Echinacea, and over through 3 days. And the first thing that shows up is that the pain started being alleviated. Then it just went away in 3 days. The infection was resolved. So that worked with every infection I've ever seen. But one patient came into my clinic a few years later who had an infection, and he was given antibiotics, and it kept coming back. And antibiotics in Chinese medicine would be seen as a cold energy, not warming. And this guy had a cold constitution. Cold meaning hypometabolic, hypothyroid type, not necessarily clinically thyroid, but just hypo in every way, systemically. And when I added, and I gave him Echinacea, and again, just like the antibiotics, it's kind of stunned the infection. It went away for a little while. When I added like a third part of American ginseng to it, all of a sudden it clicked. It's like you need the chi to pick up the acute medicine to actually get it to work sometimes. And that's like a fundamental lesson in herbal compounding. And the reason for putting things together is not necessarily that you would give ginseng for an infection, but to strengthen the system to actually use the acute herbs that you're giving.
Right. And
have you seen that kind of a result in your work?
Absolutely. I mean, there's so many ways to go with that conversation, down into biofilms and biofilm inhibition, all the way to the concepts that are coming from TCM. And one of the things that I think is really fascinating to take it that way.
So I'm going to stop you periodically when I don't understand something you said.
Okay.
You said biofilms. I don't know what that means.
Okay. Well, biofilms are biofilms are something that are going to catch on a lot more. They already are, even in regards to chronic inflammation in the body. So the body, think of your teeth in your mouth and
Right.
plaque in your teeth. That's a biofilm. If you don't brush your teeth for about 24 hours, you're going to already start forming biofilm there. Give it 72 hours and it'll be enough of a major biofilm with enough different families of bacteria in there.
So biofilm is like a substance that the bacteria attaches to and starts growing on.
That they form themselves, actually, like colonization and an entirely different type of structure, cellular structure even itself.
Right.
They have a name for it, but it's basically think of it as colonization, a very intelligent bacteria species that live together and even breed for their own food.
Right.
So this happens all over our body. This happens anytime you have an infection, in my opinion. In 72 hours in, there's going to be a biofilm of some sort there. May or may not be a problem, right? You may have an immune system strong enough for it. But going in that direction, there are many herbs that are biofilm inhibitors, and we don't really know, at least didn't at the time that I was really into this, don't really know how inhibitors work, but we know they do work. And one example of an inhibitor would be something that inhibits the bacteria's ability, for instance, to get rid of whatever came in and is attacking it. So an efflux pump. So a classic example of an efflux pump inhibitor would be MHC, would be the Mahonia species, like Oregon grape and the root and the leaf and how they work together.
So also golden seal, I would imagine.
Maybe, probably, yes, probably does. Yes. I don't really use golden seal at all. I use algarita and I use Oregon grape, but I don't really use golden seal. But yeah, probably.
Isn't that weird that golden seal is not being used just because it's threatened? I often find
I don't think it needs to be. I mean, I can do better.
Such a great herb.
I can do so much better with so many other herbs.
That's because we've accustomed ourselves to doing it, but I think you probably heard, don't use golden seal because it's endangered.
I've heard that for sure, but even before that, I was not a big fan of golden seal because I found other herbs that I felt worked better that contain berberine, that are berberine, in different, not even in the same family, but in a Berberidaceae family, right, that work better. They're better than that for the things that I would ever use golden seal for. In fact, I've never used golden seal that successfully. I've never really liked it, and of course, I don't want to contribute to any kind of over harvesting of it.
Sure.
Anyway, but so my point is that the berberine in the root of whatever, they'll say Oregon grape, and the 5'-methoxyhydrocarbon, which is MHC in the leaf, work together so that we want to use the whole plant rather than just the root of that. The reason that they work together is because that MHC inhibits the bacteria.
Again, you're using the whole plant of what?
Of, let's say, Mahonia, of Oregon grape.
So by a whole plant, you mean leaves, stem, root?
No, I'm sorry. I just mean leaf and root, or leaf and stem, or wherever we have berberine, wherever the yellow is, right? And
I didn't know that berberine was in the leaf very much.
No, it's not. I'm saying that MHC is in the leaf, and berberine is in the root.
What is MHC?
That's what I was saying. So that's the compound that inhibits a bacteria's ability to efflux or to reject the berberine itself. So in other words, it's like a potentiator of berberine, if you could think of it that way. So MHC stands for methoxyhydrocarbon. That's a molecule, a compound that inhibits the something like staph, like a MRSA, for instance, has a certain type of efflux pump, and that's why staph, like MRSA, is antibiotic resistant, because every generation of bacteria is about maybe 20 minutes long, and in that generation after generation after generation, over a period of 24 hours, 72 hours, multiple dozens of generations of bacteria that have learned that what survives or basically been formed to what survives and what doesn't. Well, what survives and what they form is an efflux pump, for instance, that rejects penicillin or whatever antibiotic might be coming in, and that efflux pump can be inhibited by a compound in the leaf of Mahonia in order for berberine to do its antibacterial duty that it does against the bacteria.
Where did you learn that? Because I never heard of that.
Oh gosh, that's been around for quite a while. That particular example is an old one, but there's many. Cayenne is one, for instance, that works well with there's several different types of efflux pumps. And so that's one anyway, but
what do you call it? Efflux what?
Efflux pump. So efflux, EFFLUX, so efflux pump. Or sometimes they're called an MDR pump, a multiple disease resistance pump. Because that's how the pharmaceutical industry looks at them. It's like, oh, they can resist any of our different.
So when you make a Mahonia extract, you also use the leaf.
Yes, generally, just depending on what I'm trying to do with it, I will use the leaf as well. Sorry, I said MDR, multiple drug resistance, I said multiple disease resistance. But yeah, I will generally use the leaf with the root. I'll tincture them separately or extract them separately. I don't just do tincture, I multifrac them, but I'll extract them separately and then blend them as I need to. For an infection where I suspect something like a biofilm, that is a good one. But a better one, and this is where I was going with this, because you're asking about the original question. You were asking about.
I'm really sorry. I'm really sorry for having interrupted you, but I warned you I was going to do that. Go ahead.
Yeah, no problem. So where I was going with that was one of the herbs in Chinese medicine that you're very familiar with. Obviously, it's going to be Scutellaria bicalensis, or Huangqin, and that is high in bicolin and bicoline that are very, very inhibitory of a lot of the different types of bacterial processes that happen in a biofilm. So in other words, Scutellaria bicalensis root, high in bicolin and bicoline, really has an effect, and an incredible effect. And gosh, I've used it so many times for so many things that are even working with doctors for things like pneumonia, this bacteria that's drug resistant. And bicolin is just incredible in bicoline. These are compounds that work very well to inhibit biofilm.
What did you say? The lung bacteria was resistant?
Yeah, like pneumonia, working with pneumonia with drug.
Pneumococcus bacteria is resistant to antibiotics.
Say again, I'm sorry. What was that?
Pneumococcus is resistant to antibiotics. Is that what you were what you were suggesting?
Pneumococcal, yeah. I mean, like triple pneumonia in one case, with drug resistance, where they were just going through different regimens for over a period of a year.
Right.
And then step in with sort of what I call a biofilm busting formulas, where you can alternate between different formulas. Well, okay, so back to Bicoline and Huangqin in TCM. Well, one of the herbs that is used sometimes in formulary with Bicoline is also Angelica dahurica, right? So Angelica dahurica or Bijur is sometimes is in there. Well, so there's some interesting studies that showed that Bijur, and these are studies out of China, of course, because they want to show, well, why is there so much empirical evidence that over the thousands of years the TCM's been around that they're formulating this? What's going on?
Yeah,
so this is where you find really good research like this, right? Because in China, they do this and they find out, hey, guess what? Angelica dahurica, Bijur, actually potentiates the amount of bicoline that makes it from the gut into the bloodstream. And it does so also, they think, probably by shutting down some of our own healthy efflux pumps that happen.
I think this is one of what you're mentioning also brings up one of the biggest problems with Western versus Chinese research. That Western research says asks the question whether something is active, whether it works or not. Chinese research is more as why does it work?
Yeah.
And I think that's really the most appropriate question to ask about herbs when you're doing research, not whether it works or not. We already have thousands of years, oftentimes, with some of these plants knowing that they work. So asking the question why they work and produces a totally different result from whether it works or not.
Exactly.
And that's why I would wish that Western research would get hip to that idea when they're talking about herbs.
Right.
Sorry to interrupt you again.
No problem. So this brings to bear this question, the original question, and as to, formulating and how some of these different formulas came about, and, talking about how some of them work. Another good example is licorice, right? And licorice root, and how that's formulated so many times, right? As a sort of a corrective assistant to kind of harmonize and detoxify other herbs in the formula. And well, guess what? It does. I mean, there's some research that shows even that it detoxifies and prevents damage from pyrolyzed alkaloids, which is the big thorn in the side of a lot of Western herbalism. Comfrey and anything that contains PAs is bad, right?
Yeah, that's a good question. So you think licorice also detoxifies pyrolyzed alkaloids?
Yeah, there's some research that shows
Fantastic.
that. Fantastic.
I wondered about that question a lot because I know licorice is used as a detoxifying herb for many, many other herbs and substances. They talk about taking large doses of it for poisoning.
Yes.
So another one that's used that way is mung bean. And
right.
I don't know how that works, but that is a use for licorice, and basically they change the properties by cooking it in honey, frying it in honey, to actually make it more of a chi tonic. So,
right.
So the whole, since one of your current interests, based on a previous conversation, is herbal medications and preparing them and making them. I wondered if you had looked at some of the ways that Chinese medicine is the herbs are modified.
Oh my goodness, yes, a lot. That's why I spend hours poring over that kind of information. Another one with licorice. Well, one with licorice I like even better is when you're using this to decoct the licorice and then take your herb and soak it in the decoction of licorice. So you can take, of course, an herb and soak it in honey and fry it in honey or heat it in honey, the way you were talking about. But what if you take another herb and you decoct that herb, and then you take your herb and you soak it, a second herb, and you soak it in that decoction, and then you go ahead and heat it until you've evaporated the decoction, and now you basically soaked your herb in that decoction of licorice, and that's used as well. Brine or salt is used as well, which is really interesting. I've been using that a lot now as a technique to be able to move herbs down towards the kidneys. Of course, it's used that way in Chinese herbalism. And guess what? It works. It totally potentiates an herb towards that direction of the body too.
That stuff is very, very important, and I've often wondered about applying that to the use of our Western herbs. and nobody has done much about it as far as I know, but I think that there's a lot to be explored in that direction.
I have so much information on that, and I do so much of it. And I'm, you know, with this new clinic, as I'm setting up the apothecary for that, I'm adding a whole wing of multifractional extraction that I have that a lot of my students don't even know about. And at one point I'm going to write a book that's going to have all of this stuff, and it's going to say, okay, this herb, here's the best way, you know, water first, then glycerin, then honey, then, you know, or, you know, the ACV may be in there. Then we do our alcohol and so forth, what order and what percentages, and have like a whole key to be able to show that for, you know, a couple hundred different herbs that we use.
That's a book to look forward to seeing. Problem with herb books these days is that it's a very limited market.
Yeah.
I mean,
it's the same percentage. So what I found, I think when I first started this, which was, you know, later than you, but for me, it was the late 80s when I first started buying herb books and looking into and learning this stuff. And I remember there was like maybe, I mean, if you looked hard, you might find 100 books on herbs, and out of that, maybe 5% of them were really worth reading. In retrospect, at the time, everything was new, so it didn't matter. But then in retrospect, it's like, well, maybe 5%. And now there's like 50,000 books on herbs, but still about 5% of them that are really worth reading, in my opinion. So
yeah, I wrote The Way of Herbs, I think it came out in 1982, and it basically was at that time the first book that was written by somebody who was practicing herbal medicine. And I account the success of that book, which is still selling, and it's with Simon and Schuster.
mm-hmm.
They probably will never take on another herb book, but they still publish mine. And I count the success of that book being that I actually gave reasonable doses, because you know, when I learned that Western herbs, basically the dosage that was being used was so minusculely small,
yeah,
and that the standard doses about from older herbalists whose books were not out was like a handful of the herb to two cups of water, and boiled that. And I said, wow, you know, that doesn't compare to the 30 drops of tinctures that people are giving, or a couple of double odd capsules. And once you start giving substantial what I call therapeutic doses of herbs, then you start seeing results. I expect to see results from the herbs I give most people, and by results I mean good or bad, because sometimes they're not always good results. And I expect to see it change within a week in some way. And if I don't see any change, that may be okay also. It means just continue taking it. But the success of A Way of Herbs, I think, is largely due to the dose, to the fact that was the first book from that period of time that actually talked about substantial doses. Now, with Chinese medicine, it's the dose per herb.
Yeah,
which is so different. And when I was in Shanghai, I took some of my students there to study. We went to the hospital, and it wasn't unusual for people to have like a third to a half a pound of herbs cooked down to 2 cups of water. That they were walking out with these bags of herbs that they had to boil, and there they weren't giving tinctures or even granules. It was like
yeah,
they walk out with a big gunny sack full of individually wrapped herbs that they had to boil.
yeah.
And sometimes it was almost up to half a pound for 2 cups of water. And if that doesn't do something to somebody, I mean, that's real medicine, herbal medicine.
Absolutely. Yeah. I think that I've been through so many different phases of medicine making, and not just medicine making, but being able to substantially transport, diagnose, and then give a prescription for herbs all in the same thing. So we have in the same building or the same room where we'll have a clinic, we'll have an apothecary, we'll have simples, we might have some pre-made formulas that we might modify a little bit, but that's it. And so what do you use? How do you dose that? How do you tell them? And so I went way, back before it was cool. Now it's starting to become cool, but it was, I went with Nalgene bottles because that was the only thing that made sense in the field. Non-BPA, you could heat those things and you still wouldn't have a problem with it, with anything leaching. And you take those into these 1 ounce, 2 ounce, 4 ounce bottles with caps on them where you could tell somebody, hey, you know, one capful every half an hour or every 2 hours or whatever it's going to be their dose, right? And that's easy. They can measure it. It's a half a teaspoon, whatever, but they don't have to have a teaspoon to do that. That made a big difference. Plus it's light. It doesn't break. Those stupid rubber droppers on the glass bottles, if you expose those to UV for 2 hours, your whole tincture tastes like rubber, you know, so you know that's not healthy. So that idea of practical distribution of your product to your clients, as well as practical intake, was something that I felt was really important to do. So I was kind of my big thing was 15-minute intake, and I would have 3 different students or 6 different students at 3 different tables doing intake, and I'm rotating. They have about 10 minutes to get everything they can. I sit down, and in 5 minutes, I look at what they've got real quick. They tell me, and then I go through and I say, no, well, I need to know this. I need to know this. And I'll ask that stuff, and I'll say, okay, here's what we got. And here's what we're going to do. And the idea isn't that we're going to take a 2-hour intake and we're going to change their life. We've got 100 people waiting at the door to get in. All of them have either chronic issues with acute flare-ups, or they have acute issues or whatever. And so they all want help right then that's going to work. The idea for me was, let's have a clinic where in 15 minutes, I can tell you what you need. You can go to the apothecary, you know, 100 feet away here, and you can get what you need and you can walk away. And in a day or 2 days, or maybe 3 or 4 days at most, you're going to notice a difference, and you're going to come back for follow-up, and you're going to say, wow, that started to work. Now what? Instead of saying for 2 hours, taking an intake and saying, okay, you need to get off sugar, you need to get off dairy, you need to exercise more, you need to stop looking at the computer, you need to, you know, all of these things. And they're going to walk away shaking their head. Oh, and I'll get you a tincture, you know, next week, come back for it.
Right.
So the idea was like really being able to do that, hustle and bustle, and make it happen. And it works. I mean, that model works for me very well, to the point where we can set up a clinic in the middle of nowhere for an underserved community, and in 2 hours we've already got people walking out and taking stuff and saying wow and telling their family, and then they're showing up. And so that's a model that I think really helps.
Well, that sounds fantastic, Sam. Kudos to you for that, and for how you're working. It's definitely not a direction that I went, but if I were younger starting out, I'd be really much more keen on learning from the perspective that you have. But I don't have a scientific bent mind. I think you're much more oriented around that.
All of these things, what I wanted to say was, all of these things that I talk about and call austere medicine, really they're fundamentals that everybody should have as a clinician. And if they're starting out and they want to be good at it, whether they're operating out of a clinic in a shopping mall somewhere, or in middle America, or whether they're in the middle of nowhere in a rural environment, it doesn't matter. These are concepts that I think, that are going to be more effective. You never really have treated a patient until their second or third follow-up. And so why not get
yes, you got to have those follow-ups, and
right. Yeah. And so why not make that happen?
Diagnosis is never right until it's been tested on the person.
Right.
I call the diagnosis a hypothesis. I don't call it a diagnosis.
Exactly.
One hardly ever gets it right the first time through. I wanted to share with you my short and easy way into practicing TCM. As you know, there are many classical formulas, and matter of fact, thousands.
Yeah.
Out of those thousands, different practitioners basically mostly work with a handful, 20 to 30.
Yeah.
And you, when you look at those formulas, you see how the same combinations of herbs are used in the formulas, similar. For instance, astragalus and codonopsis or ginseng are always added whenever there's Qi deficiency. Yeah. Rehmannia glutinosa and Ophiopagon are always added when there's yin deficiency. And things like that. You see those patterns repeating in these different formulas. So that's one thing that to keep in mind. The other is that there are actually 10 diagnostic systems in traditional Chinese medicine. I was in at the very beginning. First, it was acupuncture that came through, and no herbal medicine was at all happening. I studied with Ephraim Korngold, who was a close friend of mine and a fellow communard. And he taught me acupuncture while we were living up in Black Bear and naked bodies in a geodesic dome, doing acupuncture on each other. That's where I first learned started learning acupuncture was from Ephraim. And so when we moved to San Francisco, we decided, well, acupuncture is really great. Although the 5-element acupuncture, I question about whether it's in that category or not. By the way, I think it's sort of acupuncture psychotherapy. You just kind of like are moving chi around for months and not necessarily getting the results in a timely fashion. But so we decided to try to find out where to learn about Chinese herbs, and we found this really strange kooky guy who was a Taoist, and Taoists are not solemn people. They're kind of like crazy wisdom type of guys, and he was an offshoot, a street off of Golden Gate Park, and his name was Fun Li Wong, and we went to study Chinese herbs with him, and he said, well, $1 an herb. And we go there, 10 herbs each time. We fork out our $10 each, which wasn't easy in those days. And we got to 100 herbs, and he never told us the Western Latin what the herbs were, just only the Chinese. And he also, I asked him when we got to about 100 herbs or so, I said, well, how do I use these things? When you get to 300 plus herbs, then I'll tell you how to use them. That's when I bailed. And so I began to learn on my own by hanging out in Chinese pharmacies. And one particular one was really funny. It was in Whidbey Island off of Seattle.
Yeah.
And there was a Chinese pharmacy there, and I was teaching somewhere else during the week. And on Saturdays, I would go there and watch what he was doing. And of course, I looked like my hippie days, sitting there in the Chinese pharmacy. These people were very conservative, and they wondered what I was doing there. And everybody, I watched one person after another run into the store and say, and order one particular formula. And they rattled off the name of the formula. And the guy would throw all these herbs together. And there was like 36 herbs in the formula. Yeah. And he'd give it to them. And after it was all done, I got his attention. When I walked up, I said, I want a pound of every one of those herbs. Didn't know what they were.
Yeah.
And didn't know what the formula was for. Years later, I asked my friend in San Francisco, Chinatown, what is this formula for? And she laughed when she heard the name. She says it means soup of the day.
Ah.
And basically, it's traditional in Chinese pharmacies that they would give out a particular formula every week based on the season.
Right, so sure. Yeah.
And that was the first 36 herbs that I purchased and had in my clinic. And I started learning each one of those herbs. To this day, they remain in separate cabinets in the middle of my Chinese pharmacy with all these other things all around it.
Right.
They formed a good, solid basis for actually dispensing Chinese herbal medicine. It was from that it grew. We went to China and studied herbs there, and different ways we amplified that knowledge. But at the time when we started this, nobody was talking about Chinese herbal medicine. So all of this is to say that the evolution of Chinese medicine, which I was part of, was never really, it is an ongoing process. When it first came in, it was this kind of mystical thing of like pattern diagnosis and matching herbs this way and that way, and all these different considerations that drive you crazy when you try to calculate them all. It's like, and so Bob Flaws has a book which I call The Successful Chinese Herbalist. I highly recommend that you get that book.
I have it too. Yeah, I love Bob Flaws books.
Yeah, me too.
Big fan of his. Yeah,
and he talks about 10 systems of diagnosis.
Yep.
And all of these that are commonly used are in there, but there's one that nobody talked about, which is diagnosis by disease.
Mm.
And all up in that time, we were teaching Chinese medicine treats the root, doesn't treat the disease.
Yeah,
it's not true.
No, it's not. Really?
They treat the disease. They knew what encephalitis was back thousands of years ago. They knew what measles were. They knew these things, and they had names for them. They were
Right.
kind of metaphorical names, but they're Chinese names for disease. So I would prescribe. I then learned that the Taiwanese herbal medicine has a very different approach, where they'll combine formulas, whole formulas, they'll put them together.
Right.
And so what I learned was that I focus on the primary symptom. That's what I insist on my students have the patients tell me what's the number one or number two, but no more than that thing that they want to focus on.
Yeah.
And you build your formula around that. You find a formula, maybe it's 4 gentlemen, or it's 6 gentlemen decoction, Lu Wei Di Wang, or yin tonic or yang tonic. One of the famous ones. And then you have another symptom, and say a blood stagnation. You add that formula to it.
Yeah.
And you have another one. You add that formula to it. Now you could identify what the major herbs in that formula would be, and you can just add those herbs to the original formula. But by doing that, I'm able to get my students in their clinic to actually prescribe sometimes 3 or 4 formulas. And usually at this time we're basically using tablets. I buy them from Active Herbs, and I think they're very good quality, and they're not that expensive. And they're tablets of the standard formulas that are used.
Yeah.
For
Right.
specific conditions. And sometimes we give people 3 or 4 of those to take simultaneously, which I said, I consider those 3 or 4 to be one formula.
Yeah.
And so we're getting fantastic results doing it that way. And it's now symptomatic medicine. That's not the only way I practice. Patterns and all the other things are important. But I know I surmise that your orientation is a lot around diseases and symptoms.
To begin with, it is absolutely. So I think that it's important to like I said, to get your patient successfully navigating through taking the herbs in the first place, especially if it's a formula or it's that just doesn't taste very good or whatever. But if they can get changed right away, excuse me, something in my eye, if they get changed right away, they come back, and then you can start working through the layers of symptoms. And I think symptoms are in layers, and you eventually get to underlying causes, of course, but it depends on what they're coming in for. And this is where Chinese medicine plays a huge role for me, is to be able to start working with some of these chronic epidemiological issues that we have in America. So every country, every culture, every age, in the world has its own epidemiology that's going on. We have in America right now, one of the things that we see a lot, for instance, would be perimenopausal syndromes that tend to be either Hashimoto's or just hypothyroidism, whether it's Hashimoto's or none. And a lot of things that go around that. You can't stop gaining weight. No matter what you do, you can't stop, night sweats, obviously, all the things that are going on with that.
Yeah, those are hard
Looking at that, at something like that from a perspective of Chinese medicine, TCM is much more valuable on the overall, if you want to actually deal with this and work with this, right, over a long period of time. But that said, there are certain formulas that I like to do to be able to let's just get rid of night sweats. Or at least make you feel better about this. Let's get a couple of things that make you feel better to begin with as we start to work down towards the underlying causes, of course.
So taking night sweats as an example, of course, there are more than one cause for night sweats, but the most common indication in Chinese medicine of night sweats is yin deficiency. So if you were to treat night sweats, would you be using herbs that might be more yin nourishing?
So here's the thing with something like that's specific. We can't, if you want the long-term, you need kind of an underlying long-term approach, which would be, yes, yin deficiency, possibly. Well, it can be kidney yin, it might be kidney yang deficiency to some extent. You might see both, depending on what you're seeing in there. But to begin with, a lot of the stress, the cortisol, the issues around that age, especially if you're seeing weight gain that just can't be taken out, There are some herbs that have not, that are also, one in particular is used in Chinese medicine, not for this at all, that I find are great. And just my formulas are usually 6, 7, 8 herbs, but just 2 together that I like to use in a particular formulation are red clover at a 25% and chaste berry at a 75% for just the initial issues around there. And I think that's because what we can do, first of all, progesterone, we know, is an issue, right? As we get perimenopausal, and progesterone is one of the precursors, a very large precursor to cortisol production. So if we have stress that's just built up, Michael Moore used to talk about the $100 a day stress situation, and you've built that up over 50 years of having stress and certain types of stress, or at least let's say over 20 years of your adult life. Eventually that, those things start to come out to bear. And so if we can just deal with the issues around cortisol, around progesterone, possibly, and the amphoterrorism that we get from herbs like red clover and like chaste tree berry, we're going to see an immediate change in those particular symptoms. Meanwhile, yes, we have an underlying formula that's going to be a little slower acting that we can try to use, along with hopefully with needles, if we can too, a little bit, to help give it a little turbocharge once a week or whatever, but that are going to be either, depending on what your diagnosis is, yin or yang nourishing, kidney yin, kidney yang nourishing, and so forth. Yes.
So do you consider chaste berry and red clover to be yin nourishing?
That's the question. Are they? Because they're not really arguably red clover might be, but not chaste tree, not by Chinese medicine standards.
Yeah, chaste tree is dry.
Works really well for that, but it's more of a symptomatic. I think it's a higher level, like an initial layer of symptoms, this way I see it now. And there's other layers below that. So it's a good one to hit first, so you get some really good reactions right off the bat.
Well, that would be interesting, thinking of it that way, but I just would never think of giving chasteberry, which is drying from a TCM perspective, somebody with yin deficiency,
right?
But anyway, that's you're taking it from the standpoint of its effect on progesterone, which is
yes, and it works. That's the thing. It's like I have so much,
and it works, and who can argue with that?
Yeah, time and time again.
I always think that no matter what great theories we operate by, whether they're our own or ancient ones, nature doesn't want to conform to those things completely.
Right, exactly. And so the way that I always think of herbalism. So I have a background in language, studying languages a little bit. Music and language and martial arts were kind of my big things when I was a teenager going into young adulthood. I'd always been into them. And I went into language school my first time in the military. I was a German linguist. I speak fluent German. I worked over back when there was an East-West German border, and I was a translator, and I speak fluent German. But back then, I got a degree in linguistics, like a BA degree in linguistics, right? Because it was easy for me to get on the GI Bill, and I just wanted to study martial arts and have my way paid while I screwed around and got C's in class because I didn't care about what I was doing. But linguistics was an easy degree for me to get. Well, during that study, though, I learned a lot of interesting things, I think, about language, and one of them was that I, for the first time, realized that grammarians and the whole concept of grammar came long after language, and we're trying to take a snapshot of a moving picture of language that will constantly be changing. And the same thing is true of TCM or Western herbalism or traditional Greek medicine. And it's kind of its rehash in American, herbalism that we see. Any of those, whatever, pick one, eclectic, whatever you want. They're just a tiny little snapshot of a very moving picture of all of these thousands and thousands of plants and hundreds, millions of constituents, and how they operate in this complex, different body from me to you to anybody. There are 3 different human beings, and we act differently. So, put all the rules you want on it, but really the bottom line is, you have to have a good intuition for it. You have to have a lot of good knowledge, I think, but then you have to also be able to accept the fact that it's not always going to work the way you think it's going to work.
Yeah, I was just in South Africa and on basically a tour to see on safaris and things like that, which was phenomenal. And I did a side trip to visit an herbalist in Zimbabwe who and there the language was Xhosa, which uses fricatives, clicking boom like that in their language, which I never could quite master, but he held forth with great aplomb of the value of devil's claw.
Yeah. Harpagophytum.
Yeah.
Yeah. Oh my gosh. That's one of my favorites. I love Harpagophytum. I use it a lot.
He just was into it, and the biggest way he spent a half hour telling me. And of course, I know devil's claw from what things I read, but I never used it clinically that much. But it's supposedly, very good for rheumatic conditions and things like that. But now I told him the doses that are recommended in America are like capsules, double out capsules, 1 or 2 a day. I said, what do you recommend for doses? And he said, well, I'll call my wife in. He calls his wife. His wife is this really powerful woman who came in. He said, well, how much double claws do you think? She said, I take a heaping tablespoon 3 times a day.
Yeah.
and he said that it was for cancer. It was for all chronic degenerative diseases, and externally for any wounds and injuries. He had of course she said she takes it for lumbago, but basically it was a cure-all type of herb, panacea type of herb.
Well, I find it very useful. There's a Chinese herb that I equate with it in a Western way that doesn't fit. Another one that doesn't fit, and that's Achiranthes bidentata, the root. That's Newsy is the opinion for it.
Oh yeah, Acryanthus, right?
Yeah, Achiranthes. So that and devil's claw I use very, very interchangeably for inflammation and inflammatory process, and it can be autoinflammation. It can be RA, or it can be even osteoarthritis. I find it very useful in formulas for that.
When I first started talking about Chinese and Ayurvedic herbs, because I learned those also from other teachers, and people who were into Western herbs said, I don't want to have anything to do with that. It takes too long to learn one system, let alone learn the others. I said, well, you can't afford not to learn them.
Yeah.
Basically. So I formulated this idea of planetary herbology, which is that everything is fair game. I used it mainly the Chinese and the Ayurvedic system for classifying and understanding them. But what I've found increasingly is, while people are saying I only want to use local herbs, I only want to use Western herbs, a lot of those Chinese herbs have lookalikes, or they're almost identical herbs that are growing in our own continent. And Acryanthus happens to be a weed in my garden.
Yeah. Right. Yeah. I love that too about it. And so many different herbs that I've started over here, like Cotunia cordata is another one. And it's an invasive species in
Cotunia, yeah.
Yeah, but oh my gosh, what an amazing herb. I mean, what an amazing, and especially during COVID, some of the respiratory inflammation stuff I was using the root too, not just the flower. I found it better to use the whole plant than just the aerial parts, which is, I know what
Chinese call it fishy tasting herb.
Yeah, fishy tasting herb. And that's funny because it really does. I mean, in my opinion, it's not that, doesn't taste that weird or anything. Maybe fresh, a little bit dried, not at all. But
they use it as a steamed green.
Yeah, right. I mean, it's an edible.
Vegetable.
Yeah.
So anyway, onward. I have interest in how you approach fractures, because I think that bridges the gap of some of your work internally, and as well as first aid kinds of things. Say, for instance, somebody has a fractured disc on a spinal disc or something of that nature. What would you do for it? Would you use comfrey to begin with?
Maybe, yeah. Comfrey and horsetail. I have my famous story about comfrey and horsetail and a fracture. Is how I got into herbs in my introduction to my book. I talk about that when I was in Goat Lab in SF medic school. But yeah, I mean, so what we want to do again is to try to, with anything, whether it's bone, whether it's soft tissue, whether it's vessel and endothelium, even, is we want to move the body through that inflammatory process into being able to proliferate. And that's the faster we can do that, the more healing is going to go on. So assuming they've already had higher care, diagnosis, everything, and now we're working with herbs, the 3 things that I would do mainly is both topically and internally is to try to move blood, move lymph in the area, specifically to the area, you know, and there are so many herbs that we can do that with, whether they're heating or not, to be able to break down any kind of stagnation of the movement. And if we look at it at a Western standpoint, to be able to move from the capillary flow into the lymph for things that are too large to go back into the veins or into the veins, you know, but basically through that capillaries that are damaged from that tissue. There are, you know, millions of capillaries that are torn and damaged, and all the repair work that has to go on. And we talked about that earlier a little bit with endothelium, and herbs that can help increase that circulation, that inflammatory process. So anything you do, topic, and the back is a great place to apply topicals. And of course, acupuncture is great for that too, to be able to help, you know, as short term.
External treatment's really important.
Yeah.
It's not
well, one of the things that brings to bear one other subject I was going to say when you're talking about some of the different herbs and taking them. I think it's really one, aside from medicine making, is medicine administration is something that you have to put on your creative thinking cap, I think, as an herbalist, because there are so many different ways to take herbs. And I've had so much success with intranasal, for instance, whether it's a nausea oil or whether it's spray, you know, pump spray of isotonic solution that we make of a decoction, or even putting a little bit of tincture in there, to nebulizing it and breathing it in, to putting it on topically in the mucosa of the body, of the skin, to sublingual, to ears, you know, whether it's tinctures or oil in the ear, to, you know, topical on the oil on the eye and the conjunctiva, to, you know, compresses on the surface of the eye, to skin, to rectal, to vaginal, to, you know, sitz baths. All of these areas are things that we need to use to our advantage, because we don't have, you know, you don't have the luxury of pharmaceutical research to be able to put, you know, a medicine in with some kind of a carrier with something else and do, you know, a year or two of millions of dollars of research to be able to find what gets it into the bloodstream.
Right. I completely agree with that. Unfortunately, most clinical situations don't lend themselves to that kind of treatment protocol for patients, because they're not going to do it.
Right. So you have to make, then that's back to my earlier point about how do you make that available for the, you know, because you were talking about, you know, Chinese, how it's part of the culture. And I understand that for a Chinese, you know, person in China to be able to go in and then walk out with 5 pounds of herbs that they're going to make decoctions from. You can't do that in America. Nobody's going to do that. So you have to be able to have pre-made things that are able to work with that. And so for something like, for instance, nasal pump sprays or atomizers, those are so useful. Or a nausea oil, they can take it and just put a little bit in the nose and be able to move it into, you know, into circulation, right directly into the bloodstream, bypassing first, you know, phase detoxification of the liver, or telling them, hey, you just got to let this sit under your tongue for a minute, literally 30 seconds to a minute before you swallow it, you know, for this, or, you know, all of these different ways, but you have something that is easy for them to administer, and hopefully the shelf stable for a long time, so they don't have to worry about constantly making more, or every 3 days they've got to make another batch.
My question about all that is, do you have enough patients to actually put that much time into making all those things?
Absolutely. Yeah. I mean, and this is where, again, back to, you know, how long do you take, what should an intake last, you know, for in your clinic? And for me, a half an hour is too. Of course, I'm not talking acupuncture treatment. That's a little different, although that can go fast too. But just in terms of herbs and intake and them walking out, I want them in and out within a half an hour, you know, and that's even second, third, fourth, fifth visit, because each time we're going to be going down another layer. Hopefully they come back and they're like, that's working. What's next? And then we start working. And who knows, after 5 weeks or 5 months, you're going to get them to say, I'm going to change my lifestyle now. I've got all these other things fixed, but unless I change some of my lifestyle, I'm not going to get any further. And that's when you really start to affect people, I think, and really help them.
Well, I think for the sake of those who might be watching us having a good time here, I'm having a great time, by the way. I don't know about you, but I'm even more impressed with you as an herbalist than I was when I entered into this. And you have a very unique, from my point of view, approach to herbal medicine, and it's obviously very physiologically and scientifically oriented, and yet you're able to make this bridge with different herbal traditions and different herbs. May I call you a fellow planetary herbalist?
Yeah, absolutely.
it's a growing, you don't have to to put it on a degree or anything, but you understand what I mean, that we're not locked into a system. We're not locked into a particular group of herbs. We're locked into finding and using whatever we have and whatever is available anywhere on the planet. By the way, do you use kratom at all?
Not really. I did for a while, I even grew it a little while, and I don't know. I wasn't that impressed. I felt like I could do more with other herbs.
I always I use it for intractable pain, and it's definitely been an important herb in my usage. I've found it to not be the least bit addictive.
Right.
People I've given it to, I don't know about the people who claim that they're addicted to. I think they're just taking huge amounts for just to get stoned. And
Sure.
but I recommend that, like a teaspoon, starting out with a teaspoon twice a day of the powder. Maybe you can go to 2 teaspoons, but it works a lot like an opioid without any of the side effects of an opioid. So I use kratom. I think it's one of the great gifts of the. And I just wondered whether you've looked at it at all.
Yeah, I definitely did. You know, one thing that started to turn me away from that into other things was when I started checking out Cordalis, and I started multifracking that and then mixing that again with Bijur, with Angelica dahurica, for the same reason I talked about with Bicalensis. It potentiates the dahurica, the Bijur potentiates our Cordalis. But Cordalis, you can't just make a tincture of it. You got to multifrac it, and I do an ACV soak first, and then I do a
multifrac.
I mean multifractional extraction. You have to involve several steps with ACV, with honey, with water, with glycerin, and with alcohol in order to really get a full effect of that herb.
I'm going to stop you with each one of those. ACD is what?
Apple cider vinegar.
Okay, so you start with that.
Yeah, for this one, I soak it in apple cider vinegar first, just barely saturated, barely super saturated. Okay. And then that's a soak for about anywhere from 1 to 2 hours is fine. And then from there,
I'll do notes, by the way. So go ahead.
I'm sorry, say again.
I'm making some notes for me.
Oh, okay, yeah, okay. Well, then from there, you put it into. Basically, what I'm making is my version of a multifrac oxymel. So I'll take it from there, put it into a water decoction. And I'll decoct it. And during that decoction, about a half an hour into the decoction, I like to do just water first. About a half an hour in, I'll add glycerin. Now, my final glycerin amount for this particular herb needs to be somewhere between 15 and 20%, because what you needed to do is stabilize the precipitation that you're going to end up getting. So I put in about enough glycerin. So I know what my final amount's going to be, and I put in the appropriate amount of glycerin for that. And I also put in honey. I put in about 5 to 10% honey during that process too. And there we're using it not only to kind of offset the ACV, but we're also using it to as a solvent. Honey is an amazing solvent. So we heat that, then we decoct it at about 150 degrees Fahrenheit to 160 degrees Fahrenheit, anywhere in there. Even 170 is okay. Don't want to get it too hot though.
You're adding all these things. You're adding the water and the glycerin and the honey, and then you're decocting the whole thing.
I'm starting it in the water first, and then a half an hour in, I'm adding the glycerin and the honey.
Okay.
And then I decoct it for another couple of hours, 2 to 3, maybe even 4 hours is fine, as long as you keep it low temperature. You can decoct it longer than that even. Just keep it low. And then strain all of that, and then take your mark and put it into a percolation cone or into I like to use the Chemex. There's like a glass Chemex coffee with a really special filter that I like to use. And you can do either a 95% ETOH or alcohol wash, or even better, what I prefer in this one is to do a percolation cone and modify my drip to about 1 drop every 3 to 5 seconds, and percolate your alcohol, your 95% alcohol through there, so that you'll end up with, in your final mix, about a 30% alcohol by volume mix. So you've got 30% alcohol, about 15 to 20% glycerin, about 5 to 10% honey, and then the rest is water.
You have that in your book, by the way?
Yeah, I talk about multifracs in there briefly. Yeah, I don't get into too much detail, but I definitely talk about it. Yeah.
I mean, you talk about how you make it?
Yeah, not particularly with that herb, but I do that with several different herbs, different types of multifracs with different types of herbs. Yes.
Good. All right. Fantastic. Really interesting. I've never heard of a multifraction is that something that you have hit on your own, or
Pretty much, yeah. Yeah, I was doing, and like same thing with percolation. I know that people were teaching percolation, like Michael Moore would teach it a little bit, but I was probably the first person that made it literally part of my beginner curriculum. Is you need to learn how to do a percolation tincture. In fact, some people who are famous, quote unquote, herbalists out there learned it from me in my courses before they went out and became expert medicine makers. But this, yeah, I do it. I do a lot of that multi-frac stuff. I don't know anybody else that's really, now people are starting to pick up and do it. The thing is with herbalists, it's really funny. And I was talking to you about this, how I kind of we changed direction and started working more with licensed professional healthcare folks. But of course, we have tons of people that are herbalists that want to be professional herbalists that come to us. And we love that. We love the people that come to us from that. But they all, you can't, like, getting herbalists to group together to do anything is like herding cats. But I always say, well, turn them into copycats, because I've never found any group of people that copies what somebody else is doing more than that particular group. Every time we come out with something new, I can guarantee you in 3 months or 6 months or even a year, we're going to see another flavor of that, of somebody who either took our course, maybe had a student who took our course who's trying to do the same thing, exactly like we did it. And that's fine.
Personally, I don't mind that. I always think that I give away everything, anything and everything I learn.
It's great. I think I agree. It is, of course, not when people like literally copy a copyrighted type of information, but yeah, I agree. It's good for everybody. It's good for students more than anything. And it's good for us because it pushes us to always be out on the forefront of doing new things,
Exactly. Well, anyway, we're very, very, very much on the same track and going to the same place and from different directions. Thank you so much, Sam.
Yes. Thanks again, Michael, for having me.
I appreciate this. And I'm sure that my students and all herbal students and herbalists, I hope, will be watching us and get a flavor of who you are and what you do, and I hope that it helps to build your career and your business as it should. Thanks again.
Thank you again. Yes.
Take care. See you later.
Bye.
Bye.